We're in the middle of Indiana, in Center Point, Indiana, actually, surrounded by over 200 lions and tigers. And Joe Taft, the founder of the Exotic Feline Rescue Center, is with us today. Joe, can you talk to us a little bit about what is this place that has all these big cats?
Sure, we are the Exotic Feline Rescue Center, and we are a sanctuary for unwanted, abused big cats. When we take an animal in here, we make a commitment to provide it a home for the rest of its life. We also make a commitment to provide that animal with the best possible veterinary care. And what we're doing here today, we have a visit from the Peter Emily International Veterinary Dentistry Foundation. And they come out here about every 6 months. They fly veterinary dentists from all over the country in. They ship out 3 big cases of custom-made dental equipment because lions and tigers' mouths are not like most dogs and cats' mouths. The University of Illinois comes down with an anesthesiologist and a crew of anesthesia techs and a lot more sophisticated equipment than we have here on site. And we spend 2 days here doing serious dental work on these animals that are quite often in desperately tragic situations.
And why is it so common that these cats have such severe dental disease?
Well, some of it is poor nutrition, some of it is poor environments, and some of it, even people who try and do a good job caring for these cats, dental care is incredibly difficult to come by. So the Peter Emily Foundation coming out here is a real opportunity for veterinarians who are experienced with these kind of unique animals and have the equipment available to work on these kind of animals. So we're one of the few places, and these are one of the few groups that are really capable of doing serious dental work on these cats.
And do you notice a difference in the cat's behavior after they have a root canal or a dental procedure?
Oh yes, oh yes. They are really good at masking their pain. You know, they don't want you to know that they hurt. But when they quit hurting, you can really tell a difference.
Well, that's great, and we're so thankful for the care that you provide to these cats.
Well, and we are very thankful for all the assistance we get from the University of Illinois in that task.
You're very welcome. Thanks for joining us.
You're welcome.
Dr. Stephanie Keating is a veterinary anesthesiologist at the University of Illinois Veterinary Teaching Hospital. Dr. Keating, today your department is providing the anesthesia and pain management services for the tigers and lions having dental procedures. Could you talk a little bit about how you provide anesthesia to these unique patients?
Absolutely. So initially when the cats are out in the field in their home pens, they're initially tranquilized with a combination of sedative agents and anesthetic drugs. And once they're at a light plane of general anesthesia, they're then transported here, where we then top up with another injectable agent intravenously, and then place an orotracheal tube to secure an airway. We then connect them to an anesthetic machine and maintain the anesthesia with an inhalant anesthetic.
And I've noticed you have a lot of advanced monitoring equipment here today. Could you talk to us about what that is and why that equipment is important?
Yeah, so we have a few different monitors on our patients. On our multi-parameter monitor, we're monitoring ECG activity, so electrical activity of the heart. We're also monitoring body temperature and blood pressure directly through an arterial catheter that we place peripherally. We're also using our hands, our eyes, our ears to monitor different things about the patient, including respiratory rate, auscultating the heart, as well as looking at different eye reflexes that give us an indication of anesthetic depth.
And when you anesthetize these tigers and lions, is there anything unique about their species that's different when comparing them to, say, a dog or a cat that goes in for an anesthetic procedure?
Certainly. So there are a few aspects, and one of them is the unique field situation that we're in. So we don't have necessarily all the equipment that we might have in a hospital setting. Safety of personnel is also paramount. So we want to make sure that the cats are at an appropriate plane of anesthesia, and we have to consider the safety of the cats as well in terms of transporting them and making sure that they're safe in a field situation.
Well, thanks for joining us today and for all the great work your team is doing to keep these cats healthy. Dr. Katie Kling is a veterinarian at the University of Illinois Veterinary Dental Department, and today she's going to be talking to us about the use of dental radiographs in large cats, like lions and tigers. So Dr. Kling, could you talk to us about why it's important to take dental radiographs in these patients?
Absolutely, and it definitely is important to take the dental x-rays. That's what we're using to determine our diagnosis for these teeth, and that's what shows us everything that's going on below the gum line. So when we look in the mouth, we can see the crown of the tooth, but the inside of the tooth and the tooth root and the bone surrounding the tooth root all needs to be seen on a dental x-ray.
And I've noticed that a lot of times today they're using equipment that's fairly small and portable. Could you talk a little bit more about what that equipment is that they're using to actually take the dental radiographs?
Sure, so the processors are the same, but the dental x-rays are collected in a different way with a smaller unit, and the advantages of that are that they can get all the angles they need in a unit that can be moved in any direction, and in order to protect the people working around these x-rays, we can use lead shields and make sure that people are trying to get 6 feet away from the dental x-ray while it's collected.
Well, thanks for joining us today and for all the great work you're doing to keep these cats healthy.
Thank you.